cloud. I'd like to introduce Polly Halstead. Polly is co-chair of our educational series committee for the League of Women Voters of Western Nevada County. And Polly, I am going to turn this presentation over to you at this point.
Thank you. Well, good morning, everyone, and thank you so much for being here for this very important educational series. Today, our topic is crisis teams in the community, assisting people into services and treatment. And today we have as our speakers, Sheriff Shannan Moon, Phoebe Bell, Director of Behavioral Health, Alex Gammelgard, Grass Valley Chief of Police, Nancy Baglietto, Director of Hospitality House, and Nevada City Police Officer Sean Mason. I did a little bit of reading on this topic and I came across two programs. One is CAHOOTS in Oregon, which CAHOOTS means Crisis Assistance Helping Out on the Streets, and PERT, P-E-R-T, in San Diego, which is the Psychiatric Emergency Response Team. And I'm going to start with Sheriff Moon, and maybe she can explain what motivated her decision to fund a crisis team at this time, and how is your program similar or different from the ones that I just mentioned?
Thank you so much, Polly, and thanks to everyone for tuning in and getting educated and learning. And in this community, it's a wonderful place to work and have so many passionate people that really do care about services. And sheriff services are kind of what I'm into. So talking about the why and the when and all those different things, it's hard to pinpoint the when. I've worked in this community in law enforcement for, this is year 30, just past my 30-year mark, and working in corrections and working in the community in law enforcement. Those experiences kind of draw in, where you see your priorities, especially in the campaign and becoming the sheriff, and just knowing that there's a lot of folks out in the community that are dealing with crisis, with mental health issues, working in the jails. You get a really intimate view of someone's life when you're literally living with them. And looking at where we are nationally, and just looking at how can we better serve the community. So it wasn't necessarily a light bulb moment for me at any particular time. It was just more of a, how can we provide the best services that we can at the sheriff's office for our community? And part of that is handling and providing service for those folks that are in crisis with mental health in the community. And how can we better serve that person in crisis? And we've seen it time in and time out, is what came first, the crisis or the crime? And looking at ways in which we can really provide direction for folks when we get that call for service and a family member that's really upset because their loved one is in crisis, and how can we, you send the traditional law enforcement, and with the traditional tools, you're typically going to get, was a crime committed, and are they going to jail? When you start working in the jail, you start looking at folks and really seeing who they are as people, and you go, wow, this is a long-term kind of situation that they've been in, and does jail really, is that really the best service for them at that particular time? So looking at all those things, talking with a lot of the people in the community that have been dealing with this for a long time, not just me, with my lens and my perspective, but looking, speaking with Nevada County NAMI, and folks looking at what my peers are doing out in the rest of California. Lots of different agencies are running tandem or dual response teams. I thought, well, let's see what what we can do with that, and wanted to definitely make, we can set up a program and think that we know what we need, but I was looking at it more of a, let's set up the program and let the program develop into what specifically does our community need. So that's where we are today with the Sheriff's Office Community Crisis Response Team.
Oh, thank you. Just a quick question. Will it be one officer and then another person dedicated to this, or will they be available 24/7 or on a certain schedule?
Yeah, the way in which, because again, we want to see exactly what type of service in Nevada County do we need. We're starting off as a pilot, and it is one officer and one clinician. So talking with, fortunately having a great relationship with our behavioral health services here in the county, and talking with our behavioral health director, Phoebe Bell, trying to figure out the exact how we team that one team up. So we had some really good discussions, and so far what we've started with, and this is the pilot, and we're consistently looking at being flexible on what we need. One set, so one deputy, one clinician. They're currently working more of a later morning, afternoon kind of shift, and it's just that one team for right now.
Okay, great. Thank you. Now we'll move on to Phoebe Bell, the Director of Behavioral Health. And a couple of days ago, we had the Stepping Up meeting, and the Stepping Up program is designed to get people with mental health issues into services instead of going to jail. We're trying to, get them into services. And one thing that came out of the meeting the other day, I guess you've been operating now for about a month, from December. So you had 56 calls for service, 20 mental health assessments, 10 5150 holds, 36 referrals to community organizations, 9 people were placed in a psychiatric facility, and 1 conservatorship. So you were really busy that first month. And maybe Phoebe can tell us what community organizations and other services are available that people will be directed to.
Sure, yeah. And again, thanks so much for having us here today to talk about these exciting programs. So when we think about this mobile crisis team, we have a lot of sort of goals in mind of what we're hoping to accomplish by having services delivered in this way. And Sheriff Moon touched on some of those. It's really having the crisis experience be less traumatic for the individual in crisis is one of our top goals. If somebody's having a psychiatric crisis, they're delusional, they're not really oriented to reality, it can be really traumatic to have law enforcement intervention. It can be dangerous for everybody involved. So that's a second goal, keeping safety for everybody, the law enforcement responder, the client, other family members, community partners. But another key goal of the effort is to better connect people that are having crises to services. And so to your point, there's a lot of really great services in our community that might be appropriate for somebody. And by having this crisis response team, the team and the therapist in particular can spend some extra time really understanding what the underlying issues are for the person, and then try and figure out which resources might be most appropriate for them. Sometimes their level of psychological distress is high enough that they do need to be placed on hold and brought into the hospital to be assessed for crisis, maybe placed into the crisis stabilization unit, which is located at the hospital and is a 23-hour place that people can sort of rest and recover and ideally stabilize a little bit. So that might be one pathway. Maybe there's some substance use disorder needs. And so the connection is really focused on getting that person to substance use treatment, whether that's residential treatment at Granite Wellness Center or one of our outpatient providers, or medication assisted treatment through one of our federally qualified health centers, our primary care providers. So that might be a route that might be appropriate. Maybe the person is homeless and needing shelter, and we're reaching out to Hospitality House or the home team to sort of pick up and connect them to those kinds of resources. Depends a little bit on what needs they see when they get there, but very much that's one of the hopes is, can we build that connection, understand the needs, and ideally keep this person from needing to cycle back into crisis regularly, but instead find sort of ongoing sources of support and stability.
Thank you, Phoebe. Chief Gammelgard, I met with you a couple months ago and you talked about getting the grant for your program, which is, I guess, maybe similar to or different from the one that the sheriff is funding. I don't know if you can explain a little bit about the similarities or differences, but I know that in your heart, you would rather see people who are in crisis getting the help they need rather than going to jail, because we do see certain people going in and out of jail frequently. So I'll let you take it from here and explain what you think is going on.
Yeah, thank you, Polly, and to the League of Women Voters for holding this forum and bringing us together to talk about these programs and the other things going on in our community. I think that kind of what you touched on there about trying to move people into services is sort of the key to the future, especially with the changes that we're seeing in law enforcement. And as Sheriff Moon has touched on and also would point out, I think, is that jail is not necessarily the right spot for people. Although I do believe too that jail is the appropriate spot for some people based on the actions and whatnot. But what we want to really drive with our program, which I'll talk a little bit more about, and I think what the Sheriff's Office and Behavioral Health is looking at is what is driving that. What is the driving factor that's causing the manifestation of whatever behavior we're seeing? And sometimes that is criminal behavior. We talk a lot at the Grass Valley Police Department about trying to move further upstream and say, what is the root cause of what's causing the behavior? And what can we do to move further upstream and try to break into that cycle and have a positive impact to help influence that person's life in a positive direction? And one thing we always have to remember is that although these are people that are causing sometimes disturbances on the street, they're loved ones of family members, their friends, and their sons and daughters and mothers and fathers, and they deserve to have every opportunity to be given the tools and abilities to hopefully make a change in their life for the better. That being said, similar to the Sheriff's Office program, but also a little bit different, both with, I think, the same intention about what I was just speaking to about moving further upstream. The Grass Valley Police Department, in partnership with the Hospitality House, recently applied for and was awarded a grant through the California Violence and Intervention Program. That's a program that is available to kind of two different tiers of entities in the state of California. Luckily for the city of Grass Valley, we qualified as what's called a rural set-aside city. And we had, in order to apply, you had to be on that list. Grass Valley was on the list. And we put together an application for a program that also pairs a police officer with a outreach worker, not a licensed mental health clinician like the Sheriff's Office case, but in our case, outreach worker. And our target population is really the homeless population in Grass Valley and the surrounding areas. What we do know from homelessness is that homelessness is a manifestation of an underlying issue usually. In my experience, there's very few people who quote unquote choose to be homeless, but they may have other underlying concerns, specifically the two most common being substance use disorder or mental health, and oftentimes medicating the mental health condition with street drugs. So our goal here is to look at the homeless aspect of that and the propensity of homeless individuals to be both the victim of criminal activity or the perpetrator of criminal activity, and see where we can step in and provide resources that will help change that trajectory. Our program will pair a outreach worker who's employed by Hospitality House with a Grass Valley police officer in a full-time capacity in a police vehicle, and really similar to, in some ways, the Cahoots program, and I can explain some of the differences as well. Those two people will be out in the field and have that dedicated time to take that extra time, like Phoebe was mentioning, with individuals to really learn about what their crises and trauma are and how they can help facilitate the case management around getting them the services they need to try and change that. We're, as everyone on this call knows, a relatively small rural county in California. You know, the city of Eugene itself is almost 2 times bigger than the overall population of the whole county of Nevada. The Cahoots program in Eugene started many years ago, and it's morphed over time. And right now it actually focuses more on a medic social worker pairing. And I think from the latest data I saw there out of Cahoots, about 26,000 calls for service last year, or, you know, in the last year they had data on, which resulted in less than 500 calls for police assistance. So in their program, they're using a medic and a social worker. We just don't have that capacity here. And so our goal with a police officer and this social worker is that the two really can take on different roles. There's obviously safety concerns, and there are going to be times where enforcement is going to be necessary, particularly with our rural environment and the fire risks, and maybe the inability to allow that time that might be needed to build a relationship. Say on a PSPS warning wind red flag event, our team might be more aggressive in their enforcement for safeguarding the community, but then also working over time to try to move someone out of homelessness so we don't have to have that type of approach. So it's really going to be a yin and a yang, so to speak, but they're going to be in that relationship. And so that's similar to the PERT program, except for our focus on homeless. And then we'll work closely with you know, Phoebe's team and the sheriff's office team on the mental health components.
Great, that was wonderful. Thank you. So now we'll move on to Nancy Baglietto, the director of Hospitality House. And maybe Nancy, you could explain Hospitality House's participation in the program and maybe how you selected the person who will be riding with the officer, or will it be the same person all the time or a different person?
Well, I just want to echo the gratitude that was expressed by my fellow colleagues here on the panel. Thank you very much to the League of Women Voters for having us. Hospitality House has been doing street outreach ever since I came on board at Hospitality House. It's been, I think, several years before I got here, and I came here in 2016. So there's been a long history of Hospitality House providing street outreach services, and that has always been a partnership with county through behavioral health supporting those efforts. We were really excited when we could look at this kind of expansion of programs to partner with law enforcement and to be able to provide case management services and connection, as everybody said, getting people connected to the right services, meeting people where they're at, and making sure that we can have more positive outcomes. In 2019, Hospitality House was awarded a grant from Peace Officers Standards Training. And we have worked with everybody on the panel to create. We flew down to San Diego and we looked at the psychiatric emergency response team that's being done in that county, and even the more specific target of the homeless population. And we kind of tried to figure out our own curriculum, what best practices could we take from that larger, more resourced area and appropriate it to Nevada County, smaller, rural, and see what we could take. And that was very illuminating. I think all of us, it was kind of bonding for us to all to kind of hear what was going on in the rest of the world. We spent, I think, 2.5 days really spending a lot of time talking to a lot of personnel, and that, I would say, sort of informed my commitment to really trying to dig deeper into this and see what kind of partnerships we could continue to forge. So with that, we worked in partnership with Grass Valley to write a grant. We did not know how successful it would be. We actually came in first place. I'm going to give a shout out to GVPD for that. So we did finish in first place for the rural set aside. And we were just looking at ways to look at the county's program and Grass Valley's and see how we could work together. But we have hired a gentleman. We have actually identified the person who will take the position. Deeply enthusiastic. I don't think I've had such an interview that inspired me so much. He cannot wait to partner up. He has actually a military background with a real soft spot for social work. So kind of a beautiful melding of skills and interests. And we are hoping to bring him on board sometime in February. So that's our goal. I believe GVPD has identified their officer as well and is looking to maybe bring that person into the new role by the end of January. So we'll continue to work together. The beauty of the situation, Sheriff Moon mentioned this, I think Phoebe's mentioned it, and Alex, Chief Gammelgard, we all really work well together. And it's a really, I mean, I'm originally from the Bay Area. This kind of, camaraderie and roll up your shirt sleeves and get it done kind of thing is very special here. And we're lucky to have all of us working together, including Nevada City, because interim Chief Ellis also attended San Diego. So Nevada City has also been, involved in this. So I hope I answered all the questions.
Yeah, that's great. Wonderful. Thank you, Nancy.
Holly, could I piggyback on that a tiny bit? Just to,
sure, absolutely. Sure.
Because you originally asked, are our teams more like the PERT model or the Cahoots model or whatever? And I think that trip to San Diego that Nancy referenced was really important in sort of laying the seeds for both these programs and really sparking the thinking for all of us about what can we do differently? What can we take from these models? And I think Nancy touched on, I was probably the biggest tail dragger of the group in the sense of it's really hard to see the incredible programming that can exist in urban areas. There's all kinds of programs that we don't have in small rural Nevada County. And sometimes we don't have the resources and sometimes we don't have the volume that create the sustainability for those programs. And that's what I think is exciting about what's happening right now is through some good vision and assertive behavior by the Sheriff's Office and by the Hospitality House GVPD combo, some funding was brought to the table to pilot and try these things out so that we get a chance to see, can we make this work in a rural setting? What is it? What's the impact? Is it worth it? What's the cost? How can we sustain this? It's a really great opportunity to try some programming that we know works well in other areas, but can we make it work in this kind of setting? And I think to Nancy's point, it's really about sometimes those opportunities, you don't even realize how they're going to pay off. The relationships that get built, the visions that get seen, the ideas that get planted can sort of blossom in these other ways. And I think that's what's happening now. And it's a great, great return on investment from that small grant to start with.
Yeah, and again, piggybacking kind of off of that, some models are general mental health services that accompany law enforcement. In the Grass Valley Hospitality House partnership, it really is focused on homeless street outreach. It's kind of a subset of what we spent the majority of our time talking about in San Diego, but important nonetheless. And we're hoping that's kind of a commitment that Hospitality House has had for many years with our conditional use permit, is making sure that we're doing our part to address issues that are happening in the Brunswick Basin and other areas, because people do associate, regardless, they associate those guests with Hospitality House, even if we may not be sheltering them. But we have a commitment to the community to work with law enforcement and behavioral health to make sure we're doing our part.
Great, thank you for that further explanation. That was wonderful. Okay, so now we go to Grass Valley, Nevada City Police Officer Sean Mason. And I talked with you the other day, Sean, and you were describing kind of what you're seeing on the street as far as needs go. Would you like to fill us in a little bit about that, what your experience is?
Yes, Polly. And again, like everybody said, thank you for hosting this. I think it's good to get this information out to the public so everybody is aware that all the agencies around here, medical, law enforcement, advocacy groups are all working together to try and achieve the same goal, which is to help people, like Sheriff Moon said, prior to acts becoming criminal. In Nevada City, we are the smallest department within the entire county. And so what we tend to see a lot is the individuals. There's some that are in crisis that we deal with. Majority of the people we deal with are homeless or transient. And having come from a jail background for years, like Sheriff Moon said, I saw a lot of people coming in and out of sort of a rotating door. And, you know, some belonged there. I don't think certain actions can be used as an excuse for other actions, but there are some that people end up in jail and that's not where they belong. In Nevada City, we tend to have the warming shelters during the winters. And so we get a large influx of the homeless and transient population that comes in. And some of the people, they like our town and they stay. And so this last summer, what we were looking at is a large population of homeless and transient individuals on Sugarloaf Mountain. And so we worked with Sierra Roots and we worked with the home team and we did this pilot program to see what we can do. And we identified 17 people living up there on that hill. And we were able to talk to them and work with them and get them to pack up. And we worked with the other two groups and we were able to get them into some temporary housing. This was a program that we were doing for 30 days and we've got 17 people into hotel rooms and different things so that they're not living on that hill. And we were able to then clean up Sugarloaf and help these individuals get into a little bit more stable housing for that 30 days. And then during that 30 days, home team and Sierra Roots worked with some of the other agencies to try and further trying to further the housing situation for these folks. And at the end of the 30 days, we were able to get 13 of the 17 into some type of further treatment or assisted living where they're not going back out onto the street. For being a 30-day pilot program, I think that is pretty good. 76% success rate with that. And I think that's really a good thing. And it was a pilot program. I would like to see us be able to do some more. And I think with the sheriff's grant and Chief Gammelgard's grant and us all working together, I think that's going to be something that we can all come to agree on and achieve and be able to help those that truly need the help. And then we can then differentiate the difference between those that are in a crisis and those that are criminals, similar to what Chief Gammelgard had said. There are some people that are just not good in society and they don't want to conform to society's rules. There's others that they've been given a bad hand to play and let's see what we can do to try and help them out.
Yeah, that was a big effort by everyone to move the people off of Sugarloaf, and we really appreciate that effort a lot. What would you say you're seeing as far as the reasons people are having difficulty? Is it mostly drug related addiction issues or mental health issues? as far as the people you come in contact with here in town?
A lot of the people I come in contact with, I think, are a combination of both. It's something that has started out as an acute mental health issue and has exacerbated into a drug issue because of the self-medicating. And then, when you start messing with chemicals of the body, things, negative things are going to happen. And so where I think the first thing is getting the substance abuse curtailed and corrected so that you can truly find out what the mental health status is and then get the treatment there.
Okay, great. Thanks a lot, Sean.
Mhm.
Would anybody else like to say anything more before we move on to the questions? Does anyone have anything else to add? All righty then.
Well, I think I would just add, and I think this is probably clear, but I think there's clearly we have challenges around folks who are homeless and having behavior challenges, being safely in the community. And then just to remind people, there's lots of people with significant mental illness or other challenges, substance use disorder challenges, et cetera, that are housed and having challenges. And I think trying to meet all those different needs is really part of what this variety of programming is really trying to get at. And, as I reached out to our team to just ask them a little more input about, what are the kinds of situations you're responding to? What are some of the needs you're seeing? And had a few short stories shared with me that I think highlight really hard situations that people face and the importance of having specialized response teams and how much of a difference that could make. I think our local law enforcement partners, all of them are really sensitive and caring and have done a lot of training and work really hard to de-escalate situations and to manage situations as safely as possible for the person they're trying to help. And still, it can be really challenging. And one of the stories that our therapist shared was about a family where a young man was very psychotic and being really aggressive towards his family members, his mother in particular. And it was frightening for the parents and I'm sure frightening for the young man. And law enforcement responded. It was a challenging situation to safely restrain him. And having a therapist there just helped everybody process the trauma of that experience, helped the parents feel calmer about what was happening, feel reassured that good intentions were going into keeping their child and them safe and their adult child. And ultimately that young man was able to be transported to the hospital and placed on a hold and hospitalized and received the medication he needed to stabilize. And the whole thing happened safely for everybody involved and with less trauma than might have happened if a trained mental health professional hadn't been able to be present and sort of help talk everybody through what was happening and explaining the experience and reassuring parents about what comes next and all those kinds of things. And it's super hard to manage somebody in your life who you love with serious mental illness and support them and stay safe when they're having a tough time, and to know that there's community resources that can help you in those really tough moments, I think is really positive for our community as a whole. So I just wanted to add that piece.
Well, that was an excellent thing to add. Thank you. Yeah, it's really much better to have a mental health professional on the scene. It helps everybody involved. So thank you for adding that, Phoebe. Okay, so now we'll move on to some questions that have been sent in. One of the questions was, how will these programs be evaluated in terms of maybe data collecting mechanism in reports? Will you track each individual to see if they were successful in your treatment? Are you going to start doing kind of a database kind of thing on, like what are the issues you're seeing? Where did the person go? It looks like you already started doing some of that because we had some data at the end of December.
I can jump in on our program with Grass Valley. One of the components of the CalVIP program, as we're affectionately calling it, includes a professional outside evaluator. That was part of the context of the grant and writing it in. So we, Chief Gammelgard and myself have interviewed this person and have already started working on what the outcome and measurements are going to be, what we want to look at, which will include, number serves, type of resources made available, number of referrals. So that will be a big component of ours, is that the Board of Standards for Community Corrections, which is the funder of this particular grant, is very interested in this kind of data. They're interested in de-escalation, all of these types of things, especially with the homeless community, and how can we, what can we learn from this? So there will be more to share. If the league would like to invite us all back later and share the news, we'll be happy to do it.
Great. Did the sheriff's department or Phoebe want to add on the thing on the data collecting? I guess you've already started doing that. Was there anything more to say about that?
Yeah, we are definitely also similarly going to be collecting as much data as we can. Again, the sheriff's office invested in this program as a pilot to see if it makes a difference or not. And so that's a key part of the work is it making a difference and what kind of difference? I think I've been really grappling with what does success look like for a mobile crisis team like this? And had an opportunity recently to be a part of a statewide learning collaborative around kind of optimal crisis systems of care. And that's everything from your crisis line all the way through locked residential treatment, and what are all the best components, and what are you looking for at those levels? And it's interesting. I think in my head originally it was like, oh, the more holds that are written in the field and people transported to the hospital, the better. And really that's not the case. To some degree, it's almost the opposite. Like the number of people you can safely resolve in their home or community-based setting and connect them to resources in that setting, so much the better. With an appropriate level of holds written for the people that need that level of care. And I think we are seeing that. To me, one of the best data points in the initial data we have is that what typically happens is a lot of holds get written by law enforcement, or people get brought in to be assessed, or people bring themselves in, and many of them don't really meet criteria for a hold, which essentially means they didn't need that level of care. They didn't need to come to the hospital and have the trauma of waiting in the ED and getting assessed for a crisis, et cetera. They really just needed some emotional support, safety planning, and connection to resources. And thus far, everybody that our team has brought into the hospital has needed to be on a hold and has been placed in psychiatric care, which means they're doing a really good job discerning in the field who needs that level of care and who doesn't. And so that right there is a success. How they connect to resources, do those resources keep people from coming back into crisis? That'll be another metric I think we'll want to look at. Do we have sort of less repeat folks than we had prior to the team coming along? Things like that. But I say all that to say it's a little bit complex. There's not simple outcomes we're looking at. It's sort of stepping back and thinking about what does success mean? How do we know that this is making a difference? So more to come as our thinking evolves, I'd imagine.
Okay.
Yeah, I think some of this is going to evolve, and there's this discussion that always occurs between outputs and outcomes. And, we can measure outputs very easily. Outcomes are a little bit more difficult. Like to Phoebe's point, if the output number was how many people are being taken on a 5150 mental crisis hold or detention, and then how many are going for inpatient psychiatric treatment, that's one thing. But I think then the stories like that she just mentioned about the outcome and the impact is important. And one of the things that we're still kicking around with our program, but one of the outcome measurements and indicators that we have to measure, or we've said we will measure, is the relationship and trust building between the people we're serving and the team, and then law enforcement in general, and trying to figure out how to measure that. So we're going to have some survey and interview related things. And then the only other thing I'd say, that although we all have really great intentions around coming up with this data, we're also a small community. And so we can't really run a scientific control set styled outcome indicating scenario, just because that would mean that we're potentially going to be leaving people unserved, and or we don't have the You know, it's not like we can say, if you on this side of Brunswick Road, we're going to provide service, and on this side we're not, and then we're going to go survey these people 18 months later and see what their relationship is. And so we're going to do it best we can, but also just make sure we're doing what we think is the most appropriate thing to do, just to give people the service they need.
Great. Well,
Holly, if I could just add a little
sure.
bit also to
Yeah.
that, I think I had the same kind of complexity questions just in implementing the plan, implementing the program. Like, you want to set it up to what you think is going to be this perfect packaged plan with these perfect packaged data sets where you can measure. But guess what? We're dealing with people, and we're dealing with our community, which is different than any other community. Not because we're just special, right? We are who we are, and our people. You know, if you look at individuals, so trying to figure out what that data set is. You know, initially I was thinking, oh, we're going to save so much time in law enforcement deputies' response times waiting at the emergency room or waiting at the CSU for a hold, because every minute turns into hours, turns into multiple hours, where a deputy sheriff or a police officer is sitting waiting with someone trying to determine whether or not they do meet criteria. You're looking at all the time in which they could be out in the community doing the jobs that we pay them to do. I was thinking initially that would be a great data set, but then you start looking at, really, is that a good measurement? And that's a good measurement maybe for me fiscally, but what's the outcome? And Chief Gammelgard said it. You have to look at outcomes, and one outcome, one family that gets the services, and it turns into a better outcome for them as a family. It's hard to measure that, and it's hard to say whether or not you're going to keep a program just because you have a couple of those, or if you have one of those. I think that's the vision that I had was, hey, let's put out a better effective service, and then as we move through this, let's determine whether or not what kind of service that looks like, and be nimble and be flexible, and just really try to help people. At the end of the day, that's the mantra, is what can we do to help people? So it's going to be hard to measure, maybe infinitely.
Yeah, I can see that. Well, the community is very happy, I think, that these programs are getting started. So down the road, how will you inform the community of how things are moving along, like the successes or whatever? Because I think on an ongoing basis, we will want to hear, maybe there'll be some articles in the paper or whatever talking about it, so the community knows, what's happening and the results you're getting. I don't know whether that was a whole question.
What happened to
Yeah,
our union newspaper guy? Is he still on here?
Yeah, I was thinking he's here. But I think some stories of the successes would be great. Just like Phoebe just said, what exactly happens, on the scene and how it's resolved.
And, I think totally agreed. Keeping the community informed about how these are going, I think will be great. I think there are some public facing meetings where we will be sharing updates and information as well. Probably some presentations to the Board of Supervisors along the way in the Nevada County side, and I imagine to TV, Town Council, or City Council, other venues and forums. But I think, yeah, we should collectively all be invested in understanding what's working, and hopefully giving ourselves the grace as well to say these are pilot efforts, and we might not have it quite right, and we may be adjusting as we go and evolving, and that's a good thing, because we want to continue to improve. And as Shannon said, what can we do to help people better? If we're not doing it quite right, then let's try again. So hopefully it's a work in progress with good communication about what's happening.
Okay, great.
My name is Margaret Munson, and I am, for 37 years, I was a medical social worker in Eastern Long Island, which is like this area, quite rural, so I know about the lack of resources. I think this is a sensational program. I've also had to access the mental health program twice for a friend of mine and received invaluable help, so thank you.
Thank you. Thank
Welcome.
you. Maybe you've answered this question already, both Sheriff Moon and Nancy, but the question is, what are the credentials of the associate riding with the officer? And also, did the officer themselves get special training to do this?
I'm happy to jump in on our side.
Okay.
So one of the things that we wanted to ensure that the team that we launched on the county side is really meant to be a primarily a mental health crisis intervention team. And so we have a what's called license eligible mental health professionals. So somebody's completed all their graduate work and is finishing their hours towards licensure, which is important in that they're allowed by law to write holds which was a skill that we really felt was important, but probably equally important. We wanted somebody that had experience doing out in the field type of social work and experience with the crisis system and understanding sort of what are the parameters around crisis intervention and crisis care and who needs to be on a hold and who doesn't, and those lines. And so we feel like we got a great fit for that. And I'll let Shannan speak to specialized training for the deputy, but I think more importantly, there's also just so much on the job learning from each other. And that's one of the things we heard when we were in San Diego really loud and clear is the culture shifts and sort of institutional learning that happens by having this shared experience of a team with people with two different backgrounds coming together. And I really think that's going to be an ongoing source of improvement for us in behavioral health, and I imagine to some degree for the sheriff's office, and the same I'm sure for GVPD and hospitality house staff. You just get to see the world through a different perspective and recognize all the challenges, from our end that law enforcement faces in these difficult situations that maybe we didn't really fully grasp or appreciate so fully before. And that's going to inform us in the future. And, I imagine the other way as well. Shannan, I don't know if you want to add anything to that, but.
Yeah, ours was definitely, someone that was open, someone that was willing to take on a program from the start up. I think that was kind of more of the ideas that we were looking at was having someone that was experienced enough in their job and knew their role in the community and was open to having this new program and build it and work with it. So we selected Deputy Sheriff Galen Spittler, and Galen's on. I don't know if his camera's on or if he can just talk a little bit about the selection process and again, very early on in the program, but what he's seeing since he was selected as our officer, our deputy in the mobile crisis team.
Is Galen here?
No.
I am.
Oh, okay. Oh, hi.
Hello. So yeah, I am fairly new to the sheriff's office. I came from the Grass Valley Police Department. I spent 3.5 years there before I came to the sheriff's office. And I got the position initially came out and I didn't think much of it because I hadn't spent a year at the sheriff's office yet. And then the position was reflown and I met the qualifications at that point and was asked to put in for the position. So I did and got selected. And I think the clinician and I have worked really well together for the last month and a half now. We've been on the street. Our numbers are increasing every day, and what we're doing for the community is obviously helping. It's a need for the community, and the deputies on the patrol side, it's a need for them as well. So it's a really great program so far.
Wonderful. Thank you.
On our end, on the Grass Valley Hospitality House Partnership, we toyed and we're thinking about an LCSW or somebody with that clinical background. In the end, we chose somebody that was stronger in case management. I mean, certainly somebody who felt comfortable being on the streets. I think that's something we've kind of touched upon. It's really important that the person who is working on the streets is comfortable with that, and that the relationship, at least from the social worker and the law enforcement officer, that there is a trust relationship there, and that they have each other's backs, and that there's chemistry. I mean, that's a really big part of this, and we learned a lot of that in San Diego. This is where our work really dovetails with home team and behavioral health. If we need to escalate the situation to a higher level of mental health services, that's where behavioral health does come in. We don't law enforcement has the ability to 5150, but we really do work in partnership. The good news is that what we always hope to do is get people to identify for themselves that they want the help, and then you don't have to always do the 5150. If you can get the person to get to that part where they want to do it, it makes things a little bit easier. But that I know Chief Gammelgard, and he might want to weigh in on this, really was looking at officers who had an interest and a heart for the work. And that went a lot into his decision making. And on our end, we had a number of candidates who were really interested, but one stood above the rest in terms of having that background and of social work, but also having the comfort of being on the streets and being willing to go into camps and talk to people.
Yeah, I would take an opportunity to say one thing too, and I'll first talk about Galen Spittler, the deputy that you just spoke to. He worked for us for 3.5 years. The one thing you don't want to do on a program with this, and I don't know there's empirical data on it. I really hope there's not, because it means people were making mistakes. But I'm sure what you don't want to do is put someone who doesn't want to do it in the role of doing it, and or someone who doesn't have the talents and really the heart to do the work. And I can say Galen Spittler's a great choice, the right choice for the sheriff's office. We've just selected our officer. I won't put his name out there yet because I haven't put it out to the whole organization. But that person also, like Galen, is unequivocally the right person for our role here. But I think something that we haven't talked about, and it's a little bit off topic here, but I was just thinking about it. What programs like this do, especially in today's world of law enforcement, is they change and or I guess change is the right word, but change sounds like a negative connotation, but they change the culture of traditional law enforcement. So if Galen and his clinician are out doing that work and another deputy sees the success of that, and maybe that deputy wouldn't have been the right person to be Galen, over time, they will see the value and the impact of the work of that team in the community. And it might actually change their service delivery and how they do business, which then culturally changes the entire organization. And I think we're incredibly blessed in Nevada County to have agencies that deliver service in a way that is, I would argue, you could put it up against any organization in the country or region in the country, and how compassionate our deputies and police officers are. But programs like this have a lasting legacy impact on their department. So yeah, we can measure what is this program doing, but what we won't be able to measure, but our communities will feel, is how these programs really change and create a higher level of service from their law enforcement agencies.
Great, thank you. Let's see. Well, this gets sort of into the data thing with this question, but it seems to me that if you get people into services and they don't have to go to jail or through the criminal justice system, for instance, jail might cost $180 a day, I don't know. But then you have court charges, district attorney, probation, public defender, and all that. do you see that a program like this overall might be a cost savings to the community or to the public?
I'll take that. I mean, over time, I think yes. I think in the short term, you're going to be hard pressed in government organizations to say, hey, this agency over here is doing this. On paper, we think it's going to save that. So this people over here should give up their budget tomorrow. Well, I don't think that's going to happen. But I do think over time, when trends change, incarceration numbers change, court load numbers change, law enforcement needs because of criminal activity change, whatever all those things come out in the wash at the end of a number of years from now, it's definitely going to have an overall impact versus if we aren't always looking to be more innovative and coming up with ways to do things. So, you know, short, you know, near term, maybe not so much, but long term, I do think that we're going to have fiscal impacts that are beneficial to the community.
Yeah, I would agree. And, you know, Phoebe's team has done that tremendous work in looking at the intercepts and at intercept 0. What does that mean for a community? And you can try and put a price tag on some of those things and then look at it down the stream. But it's that piece is a little bit difficult to quantify, I think. But conceptually, yeah, absolutely. I think that's one of the benefits. I think that's one of the reasons why we say, yeah, let's try this. Because it's not just a cost, it's like a dollar number. It's a cost to a family. That's a cost to, you know, those are immeasurable. So I think we definitely are looking at ways in which we can make those more of a better outcome.
Okay, thank you. This is the last question, and maybe you touched on it previously because y'all went down to San Diego, but as a rural county, are there any issues that differ from those in urban areas? Are these programs modeled on similar programs in other rural areas, or are they modeled just from urban programs? I'm assuming, maybe wrongly or rightly, that you really tailored your programs to go specifically for Nevada County, like what are the issues here? So.
I mean, I'm happy to start, and I'm sure others have stuff to add, but you know, I think it's both and. We have a lot of the same issues as urban areas in certain ways, just a lot less of it sometimes. And we have people who are homeless, we have people with mental illness, we have people with substance use disorder, we have people who are just struggling, you know, all those kinds of things. And we have, you know, many similar challenges, and then we have really different challenges. You know, what homelessness looks like in a rural area with people camped out in the woods and fire danger and different challenges around transportation and access to services. That's different than how it is in an urban area where that plays out with different set of impacts and challenges. I think one of the things that's hard in a rural area is just the volume of need. To run programs, typically you need sort of a critical mass to be able to afford the program. And it plays out in our healthcare system. You know, we couldn't afford to have every specialist that one might need in their healthcare world serving just Grass Valley, Nevada City, for example, because the volume of patients isn't big enough. And so we sometimes have to travel to UC Davis to get specialized care for certain healthcare needs or whatever. And the same is true, and this is, you know, a behavioral health specific thing, but the same is true in the behavioral health system. We know what a lot of the great programs are that we wish we could have, but when your population is 100,000 people, you don't generate enough volume of demand for some of those services to be able to make them work very well in a rural area. And so I think that's what's innovative and unique about trying both these projects is understanding what that volume really looks like and how do we make this a sustainable program. Maybe we aren't going to be a 24/7, 7 days a week program, but we can get really targeted and specific about the highest risk or needs times. Or maybe it is so cost effective that we can make it 24/7, but we make some changes elsewhere in our system. It's trying to understand what our community can support based on the demand that it generates. Hopefully that makes some sense. It was a little rambly. Sorry.
Thank you. Anybody else?
Yeah, on our side, we definitely are tailoring it towards rural homelessness. We have really specific challenges related to that on top of, I think, some of the urban ones, but some of the urban ones don't show themselves in the same way because we don't have some of the same physical opportunities of homelessness, say storefronts and things like that. But for us, one thing that we really focused on was the geospatial mapping. Where are people where are they attracted to related to homelessness? What are the fire dangers, the environmental impacts, and the quality of life concerns coupled with all of those.
Right, thank you. Unless anyone has anything else to add, I think that pretty much wraps up our forum for today. And the League of Women Voters really thank each and every one of you for the great work you're doing out there. We really appreciate it. And we hope to do a check back with you all, maybe in a year or so, to have a little review. So thank you.
Thank you, everybody. This is Shannan from the League. I just want to remind everybody that we have recorded this. So if there are folks who missed it and want to get informed, this was incredibly informative. I was very riveted. Thank you. We will have it on our website and various other places in the community as well. Thanks, everybody.
Thanks, everybody. Have a great day.
Thank you.
Thank you so much for organizing this. And Polly, thanks for all your work putting it together.
You're welcome.
Happy Friday.
Happy Friday.
That too.